seasonal influenza, how to boost vaccine uptake and reduce vaccine hesitancy in practice. I do want to make a little caveat here that it's not a flu update. I do touch a little bit on eligibility criteria and vaccines for this flu season, but if you want to know anything about flu, obviously our recommendation would be that we direct you to do your flu training with Health Academy, and obviously I will highlight that at the end of how you access those courses. But it is lovely to have you all here this afternoon. Just to tell you a little bit about me. So I'm a nurse, so I've been a nurse for about 19 years now. And my background is mainly immunisations. That's kind of the whole of my career has been based around immunisations. I am very passionate about immunisations. Some may say too passionate, but this is a subject that is very, very close to my heart. So you might find as the training goes on, you'll see how passionate I get. I'm so passionate that I've even written a song about improving vaccine uptake, which I might touch on briefly. So just to give you an idea of what we're looking at this afternoon, we're going to give you a brief overview of the flu programme for this year. So we're slowly encroaching into flu season, although it doesn't feel like that long ago that we were in our last flu season. And we're going to briefly look at, let's say, who's eligible and what vaccines we have available this year. We're going to look a little bit about kind of the historical data on uptake of flu, where we are now compared to where we've been over the last few years, and look at, those eligibility criteria, those clinical risk groups, to give us an idea of kind of what we're dealing with, the situation we're dealing with. And what we do know about uptake, we're kind of in the worst position we've ever been in the last 50 years, and that's globally. In the last decade, so the uptake of vaccines is at an all-time low. And what we do know, when we see a drop in uptake, we see a rise in disease prevalence. So we really need to make sure that we understand about what is causing people to not come in for their vaccinations. And we're going to look at who are those hard to reach groups and why are those the hard to reach groups, and what can we be doing to improve flu uptake and vaccines in general, and looking at what are the barriers, what are the reasons that people aren't coming in to see us, because there are obviously reasons. We need to find out what those reasons are and then kind of work our way through it, and hopefully then in hand improve vaccine uptake. Obviously, a big problem that we have with vaccinations is vaccine hesitancy. So we're going to look at how do we deal with that? What causes vaccine hesitancy? And what are the NICE guidelines with regards to improving vaccine uptake and flu uptake? And just to remind ourselves about the standards, what is expected of us when we are administering the flu vaccine. I've got two screens if you wonder why. I look like I'm watching a game of tennis. So first of all, I always say, let's remind ourselves about how amazing vaccines are. And I talk a lot because I still vaccinate, especially in schools. I do a lot of school immunisations. And we really must remind ourselves how amazing vaccines are, how many lives we save, globally every day from vaccinations. And really what I say is we need to remind patients and parents how amazing vaccinations are. And so this is from the World Health Organization. And really, it says it for me. So immunisation is one of modern medicine's greatest success stories. Time and again, the international community has endorsed the value of vaccines and immunisations to prevent and control a large number of infections and increasingly cancers and other chronic diseases. Vaccines are amazing, but we need to remind everybody about why we vaccinate, what is the purpose of the vaccines, and protecting public health. That is the main purpose of why we vaccinate, making sure we discuss that herd immunity, protecting those vulnerable patients. Another quote from the World Health Organization, this came in 2021 during kind of the pandemic season, was around vaccine hesitancy. And it said that vaccine hesitancy is amongst the top threats to global health, and few effective strategies address this growing problem. So I'm going to share with you what those strategies are. And that is a recommendation that's come from the World Health Organization, because we know it's a global crisis. We're not just talking about the UK. So just to really reiterate about the eligibility criteria for this year, for this programme. Bearing in mind, from the 1st of September, we will be vaccinating children and pregnant women. So I'm not going to go through each one, because obviously we would want you to do your flu training if you do want any kind of advice with regards to flu. Just to really highlight the changes with regards to eligibility criteria, there is no change from last year, so we're still vaccinating the same patients. The two biggest changes are obviously for those patients aged from 6 months to under 2 years, the QIV-C was used off-label. The JCVI have removed that, so we can now use QIV-C without any problems around labelling. The only other change is that they've removed the quadrivalent influenza recombinant vaccine. So you'll see there that the age ranges are slightly different, and we're using a vaccine in replacement of that called QIV-HD. So HD stands for high dose. Just to bear in mind, it's a bigger vaccine, so it's 0.7 mils, and it does contain the same amount of egg as the AQIV, the adjuvanted vaccine that we give to the over 65s. Apart from that, nothing has changed. There are going to be some big changes next year because we're removing quadrivalent vaccines and we're using trivalent vaccines, so that's very exciting. So when we look at, is uptake improving? And obviously we're just looking at flu, and what we're looking at is over the years, has there been an improvement in vaccine uptake? Unfortunately, the long and short answer is no. You can see they're looking over the last few years. I'm not going to go through each group because hopefully you can see that on your screen. But firstly, we're looking at the over 65s. Bearing in mind the World Health Organization target is 95%. It's always 95% to make sure we get that optimum level of protection. So you can see there, so this flu season, so we finished in March of this year, 77.8% of the over 65s that we vaccinated, and they're always the best. They're always really, really good at coming in for their flu vaccines. Going on from there, it kind of then deteriorates a little bit. So if we look at those in clinical risk groups, 41% of those we vaccinated. I'm going to look at that in a little bit more detail. But when we think about clinical risk groups and we think about, the JCV are including these patients in the eligibility criteria for a reason, because they are at risk if they contract flu. And we also want to take the impact off of the NHS. So we want to vaccinate as many high-risk patients as we can. If we're only vaccinating 41% of those patients, that's not great. And we need to get better at that. The next bit that I find a little bit scary is pregnant women. So we can see there that we vaccinate 32.1% of pregnant women. Again, not great. Can anyone think of any reasons why we think the uptake of pregnant women is so low? I have a few kind of things in my mind that I think about. If we think about pregnant women, the most healthcare professionals they see are midwives. So we need to maybe train up more midwives to be able to have those conversations about flu. And also there's that misunderstanding sometimes that it's not safe to have a vaccine when you're pregnant. And that's why I always harp on about education. It's really, really important that we educate patients as much as possible. It's great that you are all here today as healthcare professionals together. But actually the information that I'm giving shouldn't be just for you. It's not private, it's not secret. We need to make sure that we're sharing that information with patients. They need to understand why they're eligible for that vaccine. What happens if they don't have that vaccine? What are the side effects of that vaccine? Is it safe for me to have this vaccine? They're all the questions that patients are going to want to know the answers to. And actually, when we think about pregnant women, the consequences of not vaccinating pregnant women is you can end up having a baby early, you can go to preterm labour, you can have an underweight baby. Or what can happen, and I spoke to a nurse recently who nursed somebody who was pregnant and contracted the flu, and they died and their baby died, their unborn baby died as well. So patients need to understand the consequences of not vaccinating themselves. Why are they falling into that eligibility criteria? And what is the risk if we don't vaccinate those patients? And I can see some of you have put some ideas on there about why the numbers are so low, and also think about what are you doing in practice to improve these numbers. I'm not going to talk about children. The uptake of childhood flu is always, not always great. The other bit that I found quite shocking was frontline healthcare workers. You can see there we only vaccinated 42.8% of frontline healthcare workers. And that kind of raises the question of Why is that? Is that because we don't do peer-to-peer vaccinating anymore in a lot of places? Is it because you can't access your vaccine? But the thing I worry about this is we should always be positive about immunisations as healthcare workers. If you work in the world of immunisations, as all of you do, which is why you're here today, we really want to be promoting that positivity with regards to immunisation. So we also are dealing with high-risk patients, so we could asymptomatically be carrying the flu and we could pass it on to these high-risk patients because we're unvaccinated. So again, what can we do to improve that? And I always want you to kind of go away with those messages in your mind of, Sarah said COVID and flu fatigue. Definitely, we know, and we will look at what are the barriers. But as healthcare professionals, we should have that understanding about flu and kind of the consequences of flu. Just looking at the clinical risk groups in a bit more detail, you can kind of see the numbers with regards to each specific clinical risk group. I'm not going to go through each one, but again, the numbers don't make great reading. Remembering all of the time, these patients are eligible because they're at risk if they contract the flu. So we need to be vaccinating these patients. And again, if we look at patients with learning disabilities, we've vaccinated 35% of those. So what can we do to make that better? I did actually write a blog for Health Academy about how do we vaccinate patients with learning disabilities? Because again, it's barriers that we know that we're aware of. So we need to think, who are those hard to reach groups and why are they hard to reach? And really, the JCVI are having lots of discussions at the moment about these patients because they are vulnerable patients. They don't tend to access NHS services, so they won't always come to see us. And also, they don't always have a fixed address, so they might not have a GP surgery they can attend for their vaccination. So we know the high-risk groups are those experiencing homelessness, the travelling community, and obviously the refugees and asylum seekers, and obviously the patients we don't know about. I've always wanted a vaccine bus. I've talked about this for years. I know obviously we had it during COVID, but I want a bus where I just put all of my vaccines in and I drive around and I find all of these hard to reach patients. Yes, we do it for housebound patients, but what about all of these other patients? If we think about homeless patients, the risk to them, they are very vulnerable. You can see there in Kent and Medway last year, they did have a vaccine bus, and they also did mini health checks as well, which, is amazing. I used to be a school immunisation nurse. We used to visit the travellers' sites, so we used to take vaccinations to them to be vaccinated, and we had a great reception. Lots of the children were vaccinated, and we also visited the asylum accommodation centres as well to take our vaccinations to them. And I want you to think, what are you doing in practice for these patients? The patients that can't come to see us. What are we doing to get them vaccinated? Because they need it and they deserve it as much as everybody else does. So looking at kind of, and prisons, definitely, Sarah, definitely prisons is another area. Again, the JCVI are really focusing on prisons and Hep Bs, etc. So yeah, you're absolutely right. So when we look at barriers, what are the barriers? And we know we can group these into categories. We're going to look at these in a second. So barriers accessing us, attitudes and influences and negative misconceptions. So let's have a look at what we mean by that. So when we look at when we look at accessing us, we need to think about, firstly, is English not their first language? Is there a problem? Is that causing a barrier? We always need to be thinking, what are the reasons? When you look at your clinic list and you see all your patients that haven't attended for their vaccinations, we need to think a little bit deeper and think, why are they not coming to see us? So you can get all of the consent forms and all of the leaflets for every vaccine in every language on the government websites. It could be that it's the location of the appointment. So do you offer out of hours appointments, satellite clinics, vaccination centres? If you think about somebody that works Monday to Friday, are they going to be able to access come to us in those days, or do they need evening or weekend appointments? We also need to think about childcare duties. If you've got a parent who's got multiple children, one of them needs a vaccine, what are the chances? We're in a cost of living crisis. They might be relying on public transport. How are they going to get to us? Are they going to come to us, or are they just going to think, I'm not going to bother with my vaccines? So with regards to accessing, there's lots of things to think about. And this comes from the NICE guidelines and gives us some hints and tips about what we can do to make our clinics more accessible to patients. The other thing we can look at is attitudes, and we know that this is a problem. And we do know that since COVID, there's been a change in trust of healthcare professionals. I don't know what we've done wrong, but obviously some people think that we're now, injecting chips into people so we can track what they're eating, sleeping. People think we're making lots of money from pharma companies. I wish that my job now could be to educate patients, because if we could give them all of the accurate information about vaccines, then chances are we're going to see an improvement in vaccine uptake. Obviously, people are worried about side effects, and that is absolutely fine. And again, that's just about us telling them about the side effects and what we can do to help them with that. And people losing confidence in the vaccines. We do know that can happen, especially with flu. We know flu isn't the most efficient vaccine in the world, and we know that you can have the flu vaccine and still contract the flu. Again, it's important that we give that information to patients, because they need to be able to make that decision themselves. And people not understanding that herd immunity, that herd protection. I wish I could get this message across to people that we're not just vaccinating you because we worry about you. We worry about public health, and we worry about those high-risk individuals who either can't be vaccinated or have been vaccinated and haven't developed a good immune response. But we worry about those patients. So that's what herd immunity is. We want to vaccinate the majority to protect the minority. And we do know that we are seeing a drop in vaccine uptake. When we look at measles, when we look at pertussis, we're going to see a rise in disease prevalence. The two go hand in hand together. So it's important that patients understand about herd immunity, and that good old myth that we can overload people's immune systems. We know that's not the case. We're just giving inactivated vaccines, but we might need to share that information with other people. And probably our biggest barrier is negative influences and misconceptions. So we know social media is very, very difficult to control. We know there's lots of negative messages on social media, which make it very difficult for us. I do wish the media could do more. I know we did a lot during COVID, but actually, if there were more adverts about vaccines and, what are we vaccinating for? Why is the patient having this vaccine? What are the consequences if the patient doesn't have this vaccine? These are all things that patients need to know. When we talk about informed consent, how can we say we've got informed consent from a patient if we haven't given them all of the information? I know obviously your clinic times are tight, but it's really important that we're sharing that information with patients. And it says there, making sure that we share factual information. Patients are going to hear things that might not be accurate. So it's really important that we give patients the right resources. We send them to NHS websites. The Oxford Vaccine Project is an amazing website for patients and parents to get an understanding about vaccinations. It says on the bottom there that education in school should be increased and improved. I disagree with that. We used to do assemblies, and actually the children are very, very receptive to understanding about the vaccinations. The people we need to educate is the parents. So could it be that we go to parents' evenings, open evenings, just be more present, so we can make patients aware and parents aware of what is available and answer those questions before we get to the point of having to vaccinate them. Advertising on TV and social media, is there enough funding? Probably not. Probably not. It always comes down to money, doesn't it? Anything that involves the NHS always comes down to money. But if you think about the impact of people not being vaccinated and the impact on the NHS, the cost of those patients having to attend their GP surgeries or going to visit hospitals, etc., far outweighs the cost of funding. What I always say about the NHS is it's very, very good at fixing people. What we're not very good at is health promotion and prevention. And I feel like that's the next step now with regards to the NHS. And I feel like my calling in life now is to educate people as much as possible, especially patients. So when we're looking at poor uptake, we're also looking at a big reason why patients don't come to see us is because they're hesitant about vaccines, and that is absolutely fine. And you're going to see all sorts of patients come to see you, and you are all experienced vaccinators, I'm sure, and you've heard all of the the stories behind people coming for their vaccinations. And we can look at it like this, and we can we know that some patients come to see us, don't have any questions, and they're absolutely fine. I call those the perfect patients. And then you get those vaccine hesitant patients where they want it, but they don't know if they should have it. They're a bit unsure about the side effects. They don't know if they should delay it. Is it safe to have multiple vaccinations? They've basically got lots of questions for you. And we are there to answer those questions and give as much information and education as we can. they're the patients we want to focus on. When I look at anti-vaxxers or those that refuse all vaccines, my advice would be don't waste your time trying to convince an anti-vaxxer to have a vaccine. I've tried before, and all it does is make me really angry because they're not going to listen to you. So we want to focus on the vaccine hesitant patients, and we're going to look at what we can do for those patients. When we're looking at what causes vaccine hesitancy, there's a variety of reasons, obviously. A lot of it is people just don't understand why they need their vaccine. They don't understand the prevalence of disease. They don't think they're at risk. An example of this, I hear this all of the time. My child doesn't need the nasal flu vaccine because they've never had the flu. We know that. We're not giving your child the flu vaccine because we're worried about them getting the flu. We're giving your child the flu vaccine because they carry the flu, and then at Christmas they meet up with their grandparents, they pass on the flu, and those elderly grandparents end up in hospital and can die from the consequences of flu. And that is the information that we desperately need to get across to patients and parents. It could be, like I said, the convenience. They might not be able to access the vaccinations or the services, or it could be that just the lacking confidence. I said previously about the World Health Organization, so they've given us lots of advice about what we can do to improve vaccine uptake and kind of the tools that we need to use. And the message that always comes across is something called motivational interviewing, which basically means, and obviously we're looking at those vaccine hesitant patients, we're looking at how to interact with those patients, how to have discussions, and hopefully being able to change their attitudes a bit about the vaccine that they're going to be having. And I know this takes time, and this might have to be, happen on multiple occasions, but we need to make sure that we're giving the patient the opportunity to have a discussion. And if we can actually change somebody's mind about whether they want that vaccination or not, then we've done an amazing job. And you are all doing an amazing job vaccinating all the thousands of people you vaccinate every year. We must remember we must make sure that the patient always remains at the centre of this, because what we want to do is to protect that patient. That's what we're trying to do, and we're trying to protect the community. When we're having these conversations with patients, we need to be making sure that we are taking these steps. So if you've got somebody who is hesitant about a vaccine, what we need to do first of all is ask, you tell me, what do you know about this vaccine? I vaccinate a lot of teenagers, and they all refuse their vaccines because they're scared of needles. So I always go back with that and say, that's absolutely fine. What do you know about this vaccine? Do you know why we're giving you this vaccine today? Do you know that we're potentially stopping you getting a disease that may potentially kill you? Making sure that we're asking those questions. Then, once the patient has given us a reason, so we could say to the patient, why do you not want your vaccine today? They then give us that information. We need to then go back to the patient and say, I've listened to the information you've given me. Bearing in mind, some of it may not be accurate. So can I just give you the information that is the accurate information, so then you can make an informed choice about whether you want this vaccine or not? The one for me that always sticks out in my mind, I had a mum who refused her child's meningitis ACWY vaccine because she didn't want her child to get autism. So I had to make sure that I gave her the correct information. Obviously, that's a different vaccine, and we know that was, poo-pooed. So there was no correlation between the MMR vaccine and autism. But I needed to make sure that I gave her all of the correct information, so then she can make that informed choice about whether she wants to vaccinate her child or not. So we must make sure, even if the patient still says no at the end of that, that's absolutely fine. And we need to ask at the end, looking at what we've spoken about today, have you got any other concerns, any other questions? Do you want to go ahead today? How do you want to proceed with this? And making sure, again, we're always keeping the patient at the main focus, because that's what we're trying to make sure. We're not trying to force that patient to have that vaccine, but we're trying to make sure they've got all of the correct information to be able to make that decision. And then we need to look at what is the action now. So we've done the bit of sharing all of the information. We've found out what the patient knows. We've made sure that we've corrected them if some of the information was inaccurate. And then we need to move on to the action. So if they say, actually, thank you very much for all of that information. You've explained it to me really well. I now know why I need this vaccine, etc., etc., etc. I've decided that I want to have my vaccine today. And obviously then, well done. Thank you very much. Great that you've made that decision. Make it it a positive experience? They may say to you, actually, I know I want it. I just want to go away and do a bit more research. And that is absolutely fine. Go away, have a think about it. Do you know when you want to come back, or come back and let me know when you're ready? You may still get patients that refuse, and that's absolutely fine. Just make sure patients know that the door is always open. We always want patients to know that they can always come back to us. And that's why I wrote a song called It's Never Too Late to Vaccinate, because we want patients to know that they can always come back to us. I'm actually writing a new song called Immunity in the Community. So that's now my next venture, because I want patients to learn about herd immunity. And just to say, you know, we don't talk about this enough because obviously everyone's exhausted from COVID, but flu is serious, and flu does kill people every single year. Obviously, Australia have their flu season before we do. So these newspaper articles were taken about a month ago from Australia. So you can see their mum, she had 13 children. She died at the age of 47 from flu. And there was a young boy, I think he was 2, who was unwell, went into cardiac arrest, and the post-mortem said that he died from flu. So we do know that flu is serious, and that's why patients need to understand this is what the flu vaccine, or this is what flu is. You know, some people don't even know what flu is. So explaining what flu is, explaining why they're at risk, why they're eligible for that vaccine, explain about, you know, what vaccine we're giving them, what are the side effects, and then let them make the decision about whether they want that vaccine or not. We can't just assume that everybody knows everything, because they don't. So we've got a scenario. We're probably not going to have time to go through it, but maybe, you know, take a photo of it and have a discussion with your colleagues, or, you know, answer in the chat is absolutely fine. But obviously these are common kind of things that we hear about flu, looking at pregnant women, because we know that that really has our lowest uptake. So imagine that you've got a pregnant patient coming in to see you, and they're a bit hesitant about their flu vaccine. And what I would say, any vaccine, we should be opportunistically discussing vaccines. So at any point, if someone comes to you for a blood test or whatever it is they've come to you for, we should be saying, are you up to date with your vaccinations? Have you had your flu vaccine? Encouraging those conversations, because you might get somebody that goes, yeah, I am doing my vaccine, but actually I don't think I want it because I've heard X, Y, Z. And then that's our opportunity to have those discussions with patients and try and get rid of any kind of inaccurate information that they've got. So you've got your pregnant patient and they come to see you, you ask if they've had their flu vaccine, and they say, I haven't had it because I'm not worried. It's not safe for me to have it while I'm pregnant. So sorry, I am worried. But I'm worried about it not being safe to have while I'm pregnant. They then go on to say, also, I don't understand why I need it when I'm pregnant. It's just a bad cold. I'm not worried about getting the flu. They then go on to say, don't I already have antibodies, so I can fight it? We hear this a lot. I want my immune system to do its job. I want my immune system to fight it off naturally. I've also heard that the flu vaccine doesn't work properly. So what's the point? And thinking about what can we say to these patients, you know, looking at these kind of these questions and statements that patients are giving us. You know, we know the flu vaccine is safe for pregnant women. It's an inactivated vaccine, so we're just giving the antibodies. So it's important that they understand that. We know the consequences of flu. I've said already what happens to pregnant women if they contract the flu. But actually, does the patient know that that's the implications of what can happen? We know about flu. Obviously, we have strain changes every year, which is why we have to vaccinate every year. So having antibodies might not work for you. So it's important that we explain that to the patient. And we can explain about the flu vaccine. Yes, you can still get the flu, as you can with any vaccine. No vaccine is 100% efficient, which is why we tell patients to take their own preventative measures as well. But just making sure that we are giving them all of that information to be able to make that informed choice. But also when they say to us that vaccines aren't safe or they're not worried about it, making sure that we correct them and give them the right information. If they still say no, you know, that is completely their choice. Just to say, I mentioned at the beginning, these are the NICE guidelines for improving vaccine uptake. Obviously, you can scan the QR code and it will take you to that. Really, just to give you some pointers, I've just picked out some of the recommendations that have come out from these NICE guidelines. What they really tell us is, you know, we need to make sure that it's everyone's responsibility with regards to vaccinations. Anyone who's patient facing, you might not be able to administer it, but you still need to be able to encourage those conversations with patients. And knowing whose role it is in your place of work, you know, who's in charge of targeting the patients that haven't come in yet, you know, how do we target those eligible patients, etc. Is it just a text message? Is a text message enough? Because is that giving the patient enough information? Or do we need to change what we do to make patients aware of what vaccines that they need? Raising the awareness in patients and healthcare staff. Like I said, you know, we didn't vaccinate many frontline healthcare workers last year, so we need to raise that awareness and remind people why they need their flu vaccine, and opportunistically offering vaccinations. So we should be doing this with flu. If they've come to see us for something else and you find that they haven't had their flu vaccine and they're eligible, we can opportunistically offer that vaccine. We don't want to be turning patients away because there's a risk that they might not come back. And monitoring, making sure that you're keeping an eye on what you're doing. Is it working? Is there anything we can do differently? And the NICE guidelines do say about organisational incentives. Where I used to work, we used to get a shopping voucher every time we had our flu vaccine. I know when you speak to paramedics, they get, I think they get a £20 Amazon voucher or something. I mean, we could say that's bordering on bribery, so we do have to be a little bit careful, but this has come from the NICE guidelines. So have a look at those because there's lots of information in there. Also, this came out in December of last year, so the NHS strategy. Again, you can scan the QR code. It's about 36 pages long from what I remember, and it's aimed at immunisations because we know it's quite urgent now that we improve vaccine uptake. So what they're now saying is we all need to widen the roles of people that can vaccinate. So we need more hands on deck so we can vaccinate more patients, and make vaccinations kind of the priority of anybody that works in patient-facing roles. And that could be that we need to train up more people. We might need to train up midwives to be able to administer vaccines, health visitors, you know, all of those people, all of those healthcare professionals that have that patient contact with those high-risk patients. We need to make sure that they're sharing those positive messages, but also answering any questions. I know when I had my child, you know, the Red Book was handed to me, a leaflet was given to me about vaccinations, and that was where that information ended, when actually, you know, we need to make sure that we can give as much information as possible to hopefully help people make a decision about vaccinations. Just to say, there's lots of resources out there. This is the Health Publications website. If you scan the QR code, it will take you to that website. And these are all provided free of charge from the NHS. And there is everything and anything on there. You can get leaflets in Braille, in various languages. There are multiple leaflets and posters for patients. The posters just come out for the gelatin content of the nasal flu spray from the Muslim, the head of the Muslim community, telling us about, you know, what are the options that we have for those patients. Lots of posts, and actually the NICE guidelines, when you do read the NICE guidelines, it does say we need to be advertising the fact that we do the flu vaccine. It even says to the point of putting posters on the roof of your place of work. I think that's a little bit excessive. Saying that though, I used to wear a tabard when I was vaccinated to say that we offered the flu vaccine. So again, it's just highlighting at every opportunity that we have these vaccines available that we can offer to patients. Just really to conclude, we have to talk about training standards for flu. Obviously, there is a competency assessment tool for flu, so it tells us exactly, you know, depending on our qualification, it tells us what is expected of us when we administer the flu vaccine. So prior to each flu season, we need to make sure that we are assessing each other and signing ourselves off as competent. And obviously, if you are new to immunising, which some of you may be, there are the national minimum standards. So if you've never vaccinated before, the recommendation is that you do 2 days foundation immunisation training, whether you're registered or unregistered. And obviously we do that at Health Academy. And again, even if we aren't new to vaccinating, the recommendation is every year we should read through these minimum standards and make sure there's no gaps in our knowledge. And if there are any gaps in our knowledge, we need to do some extra training, etc., to make sure we fulfill that. And then just to say, obviously, I've said already, I'm not talking about flu today. Obviously, if you've got some questions about flu, I'm more than happy to answer that. But this was really looking at how to improve vaccine uptake. Obviously, if you need to do your flu training, then Health Academy have lots of options for you. You can scan the QR code and it will take you directly to the flu hub. And they have a selection of courses for you. So you can do e-learning, you can do updates via Zoom, which I know me and some of the people here today are delivering. And we do face-to-face practical workshops as well, which also includes basic life support and immunisation techniques as well. When you are booking online, there is a discount code. You get 10% off. If you quote the code FLU2024, then you will get 10% off of your flu course that you've purchased. So please let me know if anyone has any questions. I'll say it is a bit of a whistle-stop tour. I managed to get through it or not run out of time, which I am patting myself on the back for, but really just to highlight, I know obviously time is very precious to all of you, but just remember to make sure that we are educating patients as much as possible. I'd love to hold little coffee mornings where I invite patients to come in, cup of tea, slice of cake, let's talk about vaccinations, because if we think about, especially for the over 65s, potentially they have to have quite a lot of vaccines. Now we've got a new RSV vaccine, they're going to have lots of, oh my God, not another vaccine, lots of questions. And it's the JCV, I don't make decisions about vaccinations willy-nilly because they're very expensive. So there's a reason why we give these vaccines, but we want patients to know what those reasons are. So thank you for listening, everyone. Please let me know if anybody has any questions, any ideas of what you're doing in practice at the moment to improve vaccine uptake. I would be really, really excited to hear what your tips and tricks are that you can share with all of your colleagues here today. Thank you. Anyone? Thank you, Alice. Was there any question? I know Ewan and Alice were keeping an eye on the chat box. Is there any questions? I can have a quick look through if anyone's got any questions about anything. Let's have a.
I think I've been keeping a very close eye on it. I think we managed to answer quite a few as we were going
Oh,
on.
good.
And I've put links where you've mentioned stuff as well. So if anyone wants to scroll up the chat box and get the links and things, I've been trying to send this gone along.
Yeah, I do always say, there are so many resources out there. When I teach any course, my advice always is, use your resources. The government give us them for a reason, because we know how difficult our jobs are. Immunisations are very, very difficult. They are changing continually. Me and Alice constantly tell each other about, I didn't know about the trivalent flu vaccines for next year. So Alice very kindly told me about that yesterday. Vaccines are constantly changing. It's very, very difficult to keep ourselves updated. So obviously you can do a vaccine update with Health Academy, but there's so many resources. You've got the Green Book, you've got government publications, you've got all of those leaflets and posters that we can use for patients. And the main thing is, I always say, none of this information is secret. We know why vaccines are really important, but do patients know why vaccines are really important? Well, we know the answer to that is no, because they're not coming to see us. We know our uptake is horrific. So we need to now say, right, what do we do now? What do we do next? Because we need to do more, because what we're doing, and it's not you, what's happening at the moment is not enough. And what the NICE guidelines are saying, what the NHS strategy is saying is it's now everyone's responsibility, not just you, not just nurses, not just pharmacists, not just HCAs, anyone who is patient facing. It is their responsibility to opportunistically discuss vaccines and offer those vaccines if that's something that you're capable of doing. So really important we just continually encourage conversations, because it could be you start a conversation and the patient says, actually, I've had this text saying I need this vaccine. I know I've come for my blood test today, but would you mind just explaining to me what this is for? Because I've never heard of RSV before. I need you to explain it to me. And that's our opportunity then to have those discussions with patients. So, you are all amazing. You are all extremely knowledgeable and experienced. Share your passion and your knowledge with your patients. And hopefully, next time we do this, we'll be saying how amazing our vaccine uptake rates are, and what amazing job we're all doing. But we don't want another pandemic. We are on the verge of an epidemic of measles in Birmingham and London. We know we've seen more deaths from pertussis in the first quarter of 2024 than we saw in the whole of 2023. And that is all because people are choosing not to be vaccinated. So it needs to get better. So that's why I am continuing my journey of writing my songs. I want the NHS to buy my songs, and then hopefully, we can encourage those conversations about vaccinations.
Laura, you've got a question about the song, actually. I think people are wanting you to
sing. Don't want me to sing it, do you? You don't want me to sing it. It's targeted at, so I always talk, so I did a podcast about this, and I explained it of all of us who are vaccinated, we're a bit like an army. We've all got our arms around each other. We're all linked around. In the middle of our army are those high-risk patients, those vulnerable patients that, can't be vaccinated, whatever. And then behind us are these horrible diseases and bacteria that are trying to fight their way in, but they can't because we've got this big army of vaccinated individuals. Unfortunately, as we see vaccine uptake drop off, our army drops off, which means more bacteria viruses are going to find their way in. So when we wrote the song, it's got a marching theme to it, and in the song it says about linking arms. And it's I'm not going to sing it, but it's very catchy. But it's basically saying it's never too late to vaccinate, and let's build our army and let's protect as many people as possible. But it is more of aimed at children, because we know the uptake of vaccinations in children is not great. But no, if anyone wants it, I have to be a bit careful because it has got a what do you call it? I'm not allowed to just share it willy-nilly because we're hoping someone's going to buy it off of us. But I've told that many people now, someone's probably going to steal it anyway. But yeah, my next one is in the process of being written, of immunity in the community, and just making sure patients understand. We talked a lot about herd immunity during COVID. It doesn't change with all of most of the other vaccines that we give. So we need to keep encouraging those conversations. Any other questions or anything? So yeah. Can have a scroll. I love a good song. Please do sing it. Oh God, no, I'm not singing it. Well, I might do. It just goes, it's never too late to vaccinate. That's as much as I'm doing. I'm not doing any more than that. That's enough. Thank you. I'm not, but yes, thank you. You like immunity in the community. Yeah. So if you see me in the future on TV, you can say that you saw it here first. But thank you, everybody. Unless I've missed anything, please let me know, Ewan or Alice, if I've missed anything. But thank you, everybody, for attending today and taking time out of your busy day. Is my song on YouTube? No, not yet. It's not on YouTube. My podcast is on YouTube, but not my song. But you're all making me think maybe I should. It's a #1 hit already. Don't, because my head would be so big I won't be able to go through the door. But thank you. Like I say, you're all doing an amazing job. Immunisation is not easy. Things are changing all of the time. We are all, pulling our hair out with the JCVI and the Green Book because we don't always get information as quickly as we should. The vaccine update isn't as great as it used to be. So we're kind of sometimes having to scrabble around to find information. Alice has an amazing website, if she wants to put that in the chat as well, that gives us lots of information about vaccinations and can update ourselves. But continue doing what you're doing, encourage those positive conversations with patients, and if you just change one person's mind, then you've done an amazing job. But look at what you do in your practice and see whether there's any improvements you can make as well. But thank you, everybody. Enjoy the rest of your afternoon, and hopefully I may see you on one of the other Health Academy courses. So any questions, obviously I'll be here, but thank you again, and thank you for listening. Enjoy the rest of your afternoon.